That's interesting. I just read an article today or yesterday that noticed an observation that in Africa, when they put patients, I think it was some type of parasitic infection, I think called river blindness in Africa,
Mm-hmm.
and they treated them once or twice a year. I think once a year, and they're trying it for twice. But they noticed that the communities where the individuals were treated, that they radically reduced the incidence of malaria.
Absolutely, absolutely.
Yeah.
It's the same. It's the same here. You know, the relationship between parasites and babesia is the same as the parasites in Africa and malaria. People that have parasites don't have defenses against malaria, get malaria. You eliminate the parasites, and the malaria has no chance of uh, finding fertile ground in the patient. And so it's been, I can tell you, Joe, how effective the strategy has been. Now, on my website, you find my more sophisticated medical parasite protocol, the different drugs that we're using for it. And just kind of know there will be, once we secure like the one herb that works so fantastic, once we secure like a pipeline that comes from the Himalayas, and there's a limited growth, but once it's there, it's going to be much easier to treat a lot of people in a natural way, which is my goal with this. It has to be natural. And so the last step that we do is the treatment of the viruses. You know, so we start with the parasites, we address that, we try to get positive lab tests. It's very difficult in the US. Maybe I say something to that also. Why doesn't everybody know that they have parasites? Well, I ran a parasite lab in India for 2 years. You know, I worked with one of the top parasitologists in India together, and I was running the lab. And it is a ground rule in parasitology. If you want to find a parasite, you have 20 minutes from the moment the patient has a bowel movement to finding it in the stool. After 20 minutes, most parasites use a process called autolysis. They simply release an enzyme that completely makes them disappear in the poop. And what do we do in the US? Right? We collected the poop, it sits around on a shelf, then it gets sent by mail to the lab. And 3 days later, a lab technician looks at it. It's a joke. You know, and whatever we're still finding is a miracle. But we don't have parasitology in the US. We have no available, reliable test. I know Metametrics is trying to do a DNA-based test that has a little bit of a higher detection rate, but the false negatives are so bad. The way we diagnose parasites, we put people on a treatment and then look visually in the poop, and that's my diagnostic test. And most of the time, we can document the parasites. Now, last word to that: many of the parasites are now microscopic. They're embedded in the same biofilm that the Lyme spirochetes are embedded in, and they're harder and harder to detect with the eye. And they're constantly mutating the outer surface proteins. They're very, very hard to detect in any lab test. And so we pretty much very often have to assume the patient has parasites, treat them, and then judge by the clinical success that that's what it was, and it's huge. You know, so we start with the parasites, then we launch into the Lyme cocktail, as I call it, that liposomal mix of things. And then the last thing that we do is addressing the viruses. It's important to know, you know, there's some good evidence that artemisinin and liposomal form is very effective against XMRV, the new suspected cause for chronic fatigue. Many of the herbs that we're using are antiviral, and we have a viral tincture that BioPure makes for me. It's called Virescence, where we put the key herbs together. There's a Native American herb in there that's very, very effective for most of the fatiguing viruses that we're dealing with. But the basic principle with viruses is you cannot treat a virus with viral killing agents. You have to treat viruses indirectly. And this is now where the diet comes in. And this is where sometimes the methyl B12 injections come in. And this is where other strategies come in. We have to treat insulin resistance, which we use Jonathan Wright's new protocol for insulin resistance, which is fantastic. He dug up the literature on it. We give people 1 gram of niacinamide 3 times a day, and berberine, it's basically Oregon grape root, we have that in a tincture. It's called Virescence. It's 2 dropperfuls 3 times a day. That's over 4 months, 100% successful in treating insulin resistance. Just one word to that. Joe Boroscano published it a few years ago that virtually the main known cause for insulin resistance that we find has nothing to do with the things that Mercola found. It's Lyme disease. Lyme disease induces insulin resistance. How do we know that? When we treat Lyme disease successfully, the insulin resistance is gone. And now Jonathan Wright came up with this beautiful, simple protocol that he dug up in the literature, and so far it's been 100% successful. And what I want to say here, pretty much towards the end of the interview, is that if you have a Lyme disease patient and you treat the insulin resistance, everything else is going to go easier. And
so would that mean the clinical conditions typically associated with insulin resistance, which would be obesity, diabetes, high cholesterol, hypertension?
The amazing thing is in the Lyme group, there's a subgroup that has severe insulin resistance, with high insulin resistance in the morning and high insulin levels in the morning and all the things. And they're skinny, they're vegetarians, they try to exercise as much as they can. They do all the right things, and they still have the insulin resistance. And so they have a completely different expression of the things we normally associate with it. So insulin resistance, I know it's a whole other topic or so, but it's a huge part of the treatment of Lyme disease is handling insulin resistance. With that, usually all the arthritic symptoms go away, and the fatigue greatly improves, and the sleep improves. And so things that we normally don't associate with insulin resistance improve dramatically. Jonathan Wright showed us clear evidence in the literature that osteoarthritis is an outcome of insulin resistance, which I didn't know, And so thanks to Jonathan, this has been a beautiful, beautiful treatment addition. And I found Italian literature. I mentioned that in one of my talks with you years ago, that niacin has been found to be very, very effective antibiotic against Lyme disease. So there is a link. And niacinamide has the same antimicrobial activity as niacin has. So,
but they're different, niacin and niacinamide, because the niacin will give you the flush, niacinamide won't.
Yeah, but the antimicrobial effect has been shown to be identical whether you use niacin or niacinamide. Yeah, nobody knows really how that works, but they did culture experiments, and both have the same. Maybe I say something to this. There was a cluster of outbreaks of beriberi disease in Italy, which was treated with vitamin B3, niacin, and the illness went away. And so it was concluded that it was a niacin deficiency, because what goes away with niacin must be a niacin deficiency. Years later, researchers came in and said, well, that's, we can't really do science like this. Let's look what these people really have in these clusters in Italy that have the vitamin B3 deficiency symptoms. And they did tissue biopsies, and found all of them were infected with spirochetes. And so they realized that the high-dose niacin, was a gram 3 times a day, was a very, very effective treatment for Lyme disease. And then we looked up in the literature and found that niacinamide has the same antimicrobial activity. And so treating insulin resistance is interesting with Jonathan Wright's new cocktail, also covers the Lyme spirochetes to a large degree. So it's a beautiful thing to add in. There's no side effects from it, and it's been a wonderful, additional little.
How long have you been using it?
I taught a seminar, a deep look beyond Lyme disease, which I recommend. By the way, everybody gets the DVDs or the course handout, because all my tricks are in there, and that's the first time I introduced it. That was maybe 4 months ago.
Okay, so it's relatively new.
Well,
and this is another classic example.
I used it about for a year, but it took about 8 months for me to really speak about it with authority.
Sure.
So,
yeah. So you're always on the bleeding edge, and that's why. I mean, it's great to have this information. But if we come again next year and talk about Lyme disease, you're going to have 3 or 4 new updates that are really pretty groundbreaking, and let me just state to that fact that it's not making it more complex. I mean, the beauty and the elegance of your approach is that it's all about simplification using natural methods. So it becomes simpler and easier, not more complex and harder, which is the traditional path that most physicians go towards.
There's another side to it, so that we have enough. I've been at this now for 36 years, but the more narrow Lyme treatment in the last couple of years, it is clear that with this approach, we're also addressing Parkinson and MS and chronic fatigue and illnesses that are not on the surface associated with Lyme disease. We treat a lot of children. Half my practice are now autistic children, and we put them through the same treatments and with fantastic results, and they get their life back. And so it just became my window into medicine and into life to approach medicine from that way. And believe me, once people get better, they get put on the exercise program and they get put on your website to learn how to properly exercise and how the different dietary things that you've so wonderfully explored. So that's sort of all over the world. So I have a following in Germany, in England, Switzerland, or so, and I direct them to the website. Once they're through the initial eye of the needle type of narrow treatment of the infections, we release them, basically into your hands to take them from there into the greater levels of health. And that has been a wonderful, rewarding journey.
Well, it is, and it's interesting that because there's a similar analogy in traditional medicine where they'll just take diabetes, for example, and they've got these oral hypoglycemics, these agents designed to lower blood sugar, which is only a symptom, but in no way, shape, or form the cause of the disease. And because you're not addressing the cause, they get other diseases. They get heart disease, they get cancer, because they never looked at the underlying treatment. So similarly with you, you're not treating symptoms, and unlike other physicians who are essentially treating symptoms by giving them antibiotics, and it does give them partial improvement, but it's not addressing the cause. So when you address the cause, you not only treat Lyme, but you treat all these other diseases that you mentioned.
Maybe one last words. I do not want to poo-poo the antibiotic approach. There have been times, with our patient where we used antibiotics, but maybe for 4 or 6 weeks, not for 6 years. And I do, and I do feel that ILADS, the group that promotes the very vigorous treatment of Lyme disease, ILADS, ILADS, International Lyme and Associated Disease Society, is by far the most responsible and best group, where really I've learned a lot, and I do recommend people go on that website, ilads.org, and learn everything about Lyme disease that's known, and consider, depending on where you live in the U.S., consider the treatment that's offered you through a Lyme literate physician. Most of them have been through the training at ILADS, and I do recommend that. But there is a level beyond that, which I'm hoping I'm introducing here. If you just do antibiotics, okay, you just do antibiotics. But if you think more holistically, you do the things that I recommend, and then you no longer need to resort to antibiotics because you cover the system on so many other fronts. And with that, we're not only treating Lyme disease, but we're preventing cancer, we're preventing diabetes, we're preventing Alzheimer's disease, we're preventing pretty much all the other things that we didn't know were associated with Lyme. So by treating the mold, by getting electrosmog under control, by treating the infections, by treating insulin resistance, we're preparing the patient for a much happier and healthier, longer life. And more productive life, which is, of course, what I'm hoping for, that everyone who's been ill becomes an advocate for our environment and for sane living, which we need desperately right now.
Well, it's also, I mean, just to benefit from your experience, it seems very foolish, even if you're embracing the antibiotic concept, which many people listening to this will, to ignore the years of experience you've had, that unless you address the mold and the electrosmog issue, right, you're just not going to get better. Whether it's your therapy, anyone's therapy, you've got to address those first. Right. So, you're just wasting your time, effort, energy, and resources unless you follow that advice. And it's going to be good, even if what you say is wrong, which I don't believe is the case, but even if it was, it's still going to help you in other ways. So there's nothing